Exactly. We are live and actually just wanted to give everybody the title there. So excited to have you back with us, Mike. We've been weaving in and out of with each other as we're both working on emerging new models. And you've been doing so much work since we last talked when you had Renegade Ranch. And you were the first person that really kind of blew my mind with the PMAs and what you guys were doing there. And since then, and for people that don't know, but I think so many people do know about this emerging business model, the PMA. Not that it's new, but I'd love to have you share with everyone what you're doing with that and how you're using the model, but how you're helping other people. Because I know now we have like the other versions that this has been around for a long time, but we have people that are starting schools that are doing PEAs. We have holistic health practitioners that are doing, I think, PHAs, and really breaking down. People are asking questions as so many people are going through the process. What do they need to know? How are these really working? And how is this really building out this new model that we're all visioning and talking about?
You bet. So I think I'll start with the Renegade Ranch, my experience with that and how we started the provision part of the grocery store and kind of an idea of in structure why. Yeah, we started the Renegade Ranch provisions for a couple of reasons for the most part. One was to be able to take and show our community and the people that also are in businesses, whether they're restaurants or retail stores, whatever, to be able to show them that we can come in and we can do what we want to do inside of that without the authority of the government and jurisdiction. With their some of the little petty laws that they do. And I think at a point where I didn't mind those things that they required me as a business owner for many years. And when it just starts getting petty and they start changing things and they went from in a normal, as a public servant to, no, we're not only, and then to the point where they all think that they're equal with the businesses in the community. And now it's gone the other way where they think they're above us and then they get to tell us and mandate us stuff to do. And they do that with new rules and new laws and then enforcing things that are just made up things that they have in their mind. So we did it to help our community to have a grocery store that everybody could go to where they weren't forced to wear a mask was one of the first reasons. But the second reason, and I knew right away that I had the strength of something that was real in a PMA. And for me, when I hear about something, you kind of hear it first, and then you start to learn about it, and then you own it at that point. And so before we opened the store, I owned it. And I knew what a PMA could do for us and what it would do if we opened a grocery store. So we decided to not bond our facility with an ABC permit. That's an alcohol beverage control permit for California. And we own a winery 2 miles from here. I could have done it online real easy, very cheap, not an issue. We could have bonded our facility. And I didn't do that. The main reason for 2 reasons. The first one is that I'm a PMA and I don't need to, right? Because I operate in the private. I don't deal with the public at all. And the second one is I wanted to go and take my model of what I'm doing here today and give basically a current viewpoint for the United States, other people that are thinking about doing PMAs, that I'm going to educate our local government. So right now I'm working with the DA and the court, and I'm in court with the DA, in court and with the DA, and they filed a suit against me or a judgment against me for selling to the public. And that's basically what it says. And the DA even came out and she's an assistant, and she said in court that, he needs to stop selling to the public. Well, and I had already told her what a PMA was, and she didn't. I don't think she read it, the documents I sent her, and I had to remind her, said, we've never sold to the public one time ever, period, in here. We do in the winery because we have that license, and I definitely understand the difference between those 2 things. And now you need to learn those 2 things. So we're going deeper in there. We're talking to the actual DA himself. And I've got attorneys involved, and we're going to set this system up to where it's going to be a duplicatable system for everybody and anybody to go in and see, what can happen inside of a PMA and how you can protect yourself. So we're trying to do this duplicatable piece that you can take, and if they come after you, you can just hand them the documents and say, here you go. Nevada County right here, DA said they don't have to do this, and then they go away. So that's our model and our idea of that. So
I love that it's educational based. And the other thing that is important for people to know is that this model has existed. It's not something that, has just emerged.
That's right.
It's really about learning. And there's that process of learning what our rights are and how this particular business model works. And there's a lot of people out there doing it. I want to talk a little bit too about like the logistics and what people need to look out for when they're doing it or how they're doing it. I love that you're also creating the directory. That's something that we were, looking at Haven Earth, being a resource for people. So that directory of connecting all the PMAs, because essentially what we're looking to do is, we're rebuilding the new economy. So we've had a lot of conversations, and we kind of just jumped in because we're so used to talking to you and catching up. But what's happening with that, I'm going to put on your website for people to take a look at, because what I love is that you see the bigger vision of where we're going, not just, okay, we need to get our PMA. I mean, Haven Earth got their 508 and PMA, so we've got that. But it's really about the connections and the power of all of us operating with this new business model, and what the collective can do to change this, to educate. I mean, that you're doing that with the DA on your local level. But I feel there's a sense of responsibility that comes with it. It's not just go get your PMA.
Oh, there is so much so. And I find so many people have been just put into a PMA by somebody else, and they don't educate the person that's going to be the PMA themselves. And they don't understand what their rights are. And it's amazing to see somebody in business and not understand that when the county comes to your door, that you can tell them, you need to go away or I'm going to arrest you. You're trespassing. And they have to have that believability and the strength inside of them to know that that's what they can do. And because you're going to get intimidated by people, and they're going to try and intimidate you, period. They're going to come at you hard. And not everybody and not all businesses are going to be come at, but at the front, right now, today, that's going to happen. And it's our job to be able to put people in business that are going to be strong enough to be able to resist against that.
And that's happening across the board. In every area, what we need to do. So this is just one more of these areas where we need to stand up, know our rights, and understand, not just go through the motions, but these times, I think, require the due diligence to do the research and to really understand what our power is as we take that back.
Absolutely. Yes. So in a PMA, and what it kind of does, and I like to start off with this really simple analogy. And my wife, she rolls her eyes and kicks me when I start off with it, but she's not in the room, so I get to do it. And so what it is, it's really simple. So Vanessa and I, we're at your guys' house, and we're hanging out, and we're having dinner, and we're having a glass of wine. And somebody else comes over, and we got a few people there hanging out, and somebody just came back from Mexico, and he's got a case of tequila. And I like tequila, and my wife likes tequila, so we all do a little tequila tasting. And I'd like one of the bottles. So I ask our friend, can I buy a bottle of that from you? And he says, yeah, absolutely. So I buy it. And in that scenario, we're protected in our Constitution that allows us to have freedom of association. And you're also allowed to have business freedom of association in private. So that whole scenario where I buy a bottle of tequila in the private allows me to buy that without a license. It allows him to sell it to me without a license. So we don't have any government interaction at all. There's no authority, no jurisdiction. So we can take that same exact thing, and we can take it downtown New York City in a big old huge building with thousands of people in it. And if I'm a member of that club with that person in that business, I'm allowed to do the same transaction. He can sell it to me without a license. I can buy it without a license. And it's that simple. If and you go away today from this whole thing, and that's the piece that you understand right there, then that's enough, because you get the basic concept of what's going on. And you can apply that to any business across the board. And I don't care whether you're a doctor or you're whatever, it doesn't matter. Anything at all, period, 100%. So the PMA it's a lot of times people get it confused. It's a business entity, and that's all it is. And it's a business entity like an LLC or a corporation or a sole proprietorship. But those three all exist in the public, where a PMA exists in the private. So it's private business, and we're allowed to do that in the Constitution. So when you have that private business, you don't adhere to all the laws that have been made by the USDA, by the FDA, by your local city, your local county. All those things don't happen. Your federal government, your state government. Those things that interact and are made for interaction with the public do not apply to us.
Yeah, interesting, Mike. Actually, a friend of ours that we were with here in Texas last few days, he wanted to try it out because we talked about our PMA. So he plays golf. So he went into the golf course with his son, who's 15, and he went to the bar and he says, "Can you serve my son alcohol?" And the guy said to him, "If you say it's okay for us to serve your son alcohol, we can serve your son alcohol." and he asked and he talked to him about what they are set up and is the PMA basically, and how
Yeah.
it's been there and it's been in the mainstream in a lot of respects, but just
Hidden.
for some like kind of hidden. But I think it's because we never needed it, right? I mean,
Right.
it's
That's
only
exactly.
need it.
Yep.
So
We didn't
it's
need it until we got forced into it, right?
right.
Then it becomes popular.
Right.
And then, so in my PMA, I would never sell alcohol to a 15-year-old, whether his parents said they could or not, or give him anything to
Sure.
drink.
Sure.
And that's just a personal responsibility on my side. But technically, I think you probably could. And here's the thing that could break and pierce their veil is that in the stipulation of that is if you're doing current harm, right, and we're talking bad harm like killing people, that's how they can pierce your veil.
Right. Exactly.
And that would be somebody could say that substantial evil is being done when you're serving alcohol to a minor, right? And that could be breached and put them in trouble.
Right.
So in the PMA, it's a business vehicle, right? It's an entity business vehicle, and that's how you go to business now. So, and that's when we're looking at our parallel society, and we're going to get into that in a little while. With our 100 million people, that's how the businesses are going to survive outside of the other if we're not vaccinated. And that's what they've done is they pushed us away for not being vaccinated from the hospitals, from our, from everything that we do, all the retail stuff, unless you're big box. For some reason, nobody gets COVID in a big box and you're allowed to go there, so they don't care. But little mom and pop stores, they want them all out of business. And the way that those guys are going to stay in business if they're not vaccinated is to become a private membership association, period. That's one thing that's going to happen.
That leads us to the strength in numbers, I think, which we kind of need because I think Renette's mentioned it before about, when there's one guy or there's one business, they set up PMA, it's easy to knock them down, to maybe turn off their electricity, whatever it takes is to kind of shut them down and shut them up, basically. But I think what you're doing now with the directory, it's creating this force in numbers that isn't top level. They can't just come and hit somebody and take them out of business. They have to look at the whole. And so I think what it is they'll just steer away from it. Actually, they won't come at it. There's enough people who are willing to go along with the agenda.
Right.
So they'll just focus on them. And like you said, it's creating a new waste stream. So maybe talk, what's this directory about? What you're doing with that? Sure.
So what we've done is it kind of started off with the hubs, the healing hub, right? So that's a medical group that we're put in place, and we're building currently today. We're doing the mini hubs, and we've got like 70 of those across the country going in, and we're building hospitals.
Explain the healing hubs a little bit, Mike, for people that don't know what are those going to be. Yeah.
Okay. So what we did is locally in our community, we have people dying of COVID that aren't being treated in hospitals. And our whole goal to start with was just to keep people out of the hospital with COVID. So we created these little mini hubs that basically they're going to be supplement businesses for people. And a lot of them have been, fired from their job in hospitals. So these supplement businesses are going to have their frontline doctor protocols. They're going to have oxygen concentrators. They're going to have nebulizers and a bunch of other things that are necessary to be able to take and help the person who's just getting sick, but not really sick yet. So just to keep them from getting sick, right? Not to get to that point. So we're going to have a national call center that's teaming up with us, and these little hubs are going to be set up across the country where they can go pick up a prescription, and then they can deliver the products right to the patient and to help and keep them out of the hospital, right? So we want to hit them right away, right up front, and then the next level, we're thinking about things that could happen in our community is that. What happens if we break an arm or a leg or we need stitches or we have a cold that's not part of that COVID piece? Then we decided we needed to take and we need to build that infrastructure. And we're doing that in basically their outpatient care facilities. So we've taken our property here in Nevada County, and I have a 20,000 square foot building on a commercial property, and we're going to take 10,000 square foot of it, and we're going to turn it into an outpatient care facility. So it'll be a little mini hospital. And then we'll say, okay, great, but there's no beds in it. You can't spend the night. So we're actually found a building that I want to buy with a group, and we're out with investors right now trying to put it together and buy this building. And it's like 25,000 square feet. And we can have a bunch of beds in there. And we can do a little mini hospital. It can actually functionally work as a mini hospital, and it'll be out there and going. And what we're doing is when I speak, and I try to speak in front of people 2 to 3 times a week, and I'm on Zoom calls with hundreds of people a day. And I reach out to the community that we're talking about and talking to. It's like, get off your butt, go find a doctor in your area, Let's find the system. Reach out to me. I'll help you with that. Completely putting all the contacts together, and let's take your money that is extra money that you want to invest somewhere. You're looking for an investment anyway. Come to us and let us help us build hospitals and mini hospitals around the country. And we need to do that. It has to happen because right now, today in California, there's been numerous instances of not just COVID patients, but other patients as well, where they go to the hospital and they're not vaccinated and the hospital won't take them at all. They push them out, which for me and other people who know how to treat COVID is a great thing because now they actually have a chance to survive, right? Because the hospitals don't care. They're just putting them in there and letting them die, and they're not treating them with things. And it's criminal because they know how it could happen. They know how to treat people and they don't do it. They actually know how to do it and they don't. And they've seen so many cases, thousands and thousands of cases of people being treated properly and then don't die and don't get as sick as the ones that finally get to the hospital. So that was all set up. Currently today, we probably have 10 locations around the country right now that are going to be the outpatient care centers. And we have places around the country right now today that are already outpatient care centers that are coming on board with us. We have family practitioners that are on board with us. We have pediatricians. We have everything that you can think of in the healthcare community that are a part of what we're doing here today that are going to be part of the bigger picture. And that's why I did the bigger picture, which is called the Renegade Nation. And that was the whole idea and structure is that we need to get this word out fast. And as this Delta variant comes through and sweeps through the country, and it's leaving some neighborhoods, but it's hitting others now, and we'll have another one coming right behind it. And we need to get this out fast so we can have the support. So that person that's just like right on the edge of going to get a vaccination has a place to go that they know they can go to the hospital instead of dying of COVID and or not being treated and or getting a shot, because they really don't know that piece of it. So
a couple things people are commenting, but one thing I wanted to ask Mike with the recent situation with all of the healthcare practitioners that are being fired that because they're refusing to get injected. What do you think? Are those people reaching out to you? What do you see happening with that trend as far as the doctors and nurses that are starting to stand up? And how do people get in touch with you, or what's the recommendation for them to reach out if they have either a facility or they're a doctor or healthcare practitioner that's looking to be connected with this network?
We have some of the biggest doctors in the nation that are coming on board with us. So they're known across the country, and not just some, but hundreds of them. We have hundreds of doctors that are coming on board and doing this. And whether they're going to be a PMA or just go out and sue, because a lot of them are in red states. And the red states are not being harassed as much as we are in the blue states, right? So they're going to stay where they're at and they're doing their things, but they're all going to be a part of the Renegade Nation. And what the Renegade Nation really is, and that's kind of the national piece to keep everybody together and let them know that they're there. And it's hope, right? It's the hope that we know that the things that we need are coming along, and they are. Something miraculous happens every single day. We have a need to fill a question that gets asked of me, and I don't have a place for it. And it's like by the next morning, that solution is here. And it's crazy how fast it works and how great it is. So the Renegade Nation it's a website. And it's
is that live now, or is that, I know you were
2 weeks. It'll be up in 2 weeks. So
okay.
it's massive, right? And the things that happen, and I'm not doing it in a regular network because I don't want those guys to take it down. And we want to keep it, inside of our group. So it's
going to be the renegadenation.com or just Renegade.
So it's the renegadenation.org.
.org. Okay.
So mine for the PMA team is mike@thepmateam.club. That's my email. Yeah. And then the PMAteam.club is the web address it's the website for the PMA team.
I'll put that in there. I put up the website already, but I can let people know. Okay. So reach Mike at the PMAteam.club.
There you go.
And tell him you watched this live stream. I mean, I'm so excited for us to be partnering with you because we've had this affinity of we're all doing our niche focus groups, but to hear what you're doing, what you're getting done, and we're having the same experience. It's like everything's moving so fast. The solutions are coming in. It's so much of it is about staying open to it. And how are you managing, Mike? Because this is crazy busy. Like this is a lot. Like I know you're expanding your
staff. Yeah, as we grow, we just staff up for it. So The thing is, in the Renegade Nation, once that hits, it's going to be able to take away a lot of my burden, my time I spend doing things that can be done with a site, right? Because inside the Renegade Nation, it's kind of cool. The platforms, it's got a lot of embedded things that are being able to be done in it. And so it's kind of like on the light side of starting off, it's going to be a job board for people that have been fired across the country, right? And in the same platform, it's going to have all the employers that across the country that are part of this 100 million people that have been ostracized from that side of things, not getting a vaccination. So they're going to be inside this, and they're going to see your stuff. They're also going to be posting ads in there for employees. So when they do that connection, it's huge, because we need to put our people back to work, and we need to be able to fill the position so that the jobs can be filled, so that business owner can get back to work. Because I've gone into restaurants before that aren't even still today, they're not open for business other than takeout, because they can't get anybody off their butts to come in there and work. And it's like, wow, still today. So this group of people that are in this society, this 100 million plus, our new parallel community, our tribe, whatever you want to call it, we're here. Whether you know it or not, whether you accept it or not, this is where you are.
Exactly.
This is the Renegade Nation. The next piece of that is going to be podcasts all the time. There's going to be trainings for every single vertical market you could ever imagine. Health food, healthy, the healing hub and portion of it is my passion, because I've been led and felt like that's where I've got to be right now. And I have zero healthcare experience in my life. The only thing I know about health is that, I've had a lot of stitches and broken bones, and I don't get sick at all, but I've done a lot of those. So that's my interaction with the health, and that's it. But I'm learning as I go, and it doesn't matter. I don't have to know it, because so many people do, and we're connecting to people in place. So inside the Renegade Nation, you're going to go in there and you're going to click on a vertical market, whether it's healthcare, education, food, a group of attorneys, which, believe it or not, we actually need attorneys in this world. We have constitutional lawyers and attorney group. We have a contracting group. There'll be a retail group, and then every group of everything that we have will be inside this. And I always use the example of the Healing Hub. So you go in there in healthcare, the Healing Hub pops up. It's a picture of the United States. You click on the state that you're in, and then you click on the county that you're in, and it'll populate every single business that is a free-thinking business that's not going to require you to have a vaccination passport and or a mask and or anything at all. They're going to accept you in there at who you are and as you are, and accept everybody in, knowing that you don't need to be in there and be harassed. And that's the whole point of it. Keep our money in our group, grow our group.
So, Mike, I think it's so important to paint this picture, because we're in it,
Yes.
We're all doing this every day. But for people that are listening in, I know this is going to give a tremendous amount of hope. That this is already happening. You mentioned the parallel, groups. And so and part of it is getting people who might not know this exists to actually discover that it is. One way, you're talking about the podcast, and I know you and Eric Naputi have been in contact, and I'm going to schedule you to be on the show, and I'm putting that link, because if anybody's not tuned into the private radio show, which is realtalk933.com, been speaking to him this week. We're going to get you on talking. I mean, it's 4 million, listeners every day, and things like that, where we can get the word out, because we're doing it, but it's really important to get the word out, and for people to be able to identify the pathways, right? Your website, the directory, the radio show, where we aren't being silenced. Not only are we not being silenced, but we're actually building out these new systems. So I think it's so important what you're doing. What's your vision for this? I mean, and how is this going to work with these parallel, what do you call them? Parallel worlds, really?
Parallel society, right?
Parallel societies.
Yeah, because we used to be all one society, and I think my vision is encompassed in so many different things. But inside of our parallel society, and I really truly believe that we're going to have well over 100 million people that do not want to be vaccinated. And the thing is that our parallel society isn't just for those people. It's also for the people who have been vaccinated, some willingly, some because they wanted to, and then now they have vaccine regret, right? And they know that they shouldn't have done it. And it's also for the people who were forced to be vaccinated to either lose their job, or because the family, one of the people in the family mandated that you didn't, so all those things, that those people that don't want to be there, they're going to be part of our team as well, right? And anybody at all, we're not going to discriminate. We don't care where you are and who you were before. You want to be part of what we're doing here, which is, you're not going to tell us we're going to do anything at all with a vaccination passport and or a mask, right? Those are the things that we're free from. So as those people grow into our community, it's going to allow us to be the strongest 100 million plus people community that this world's ever seen, that especially our country, because we're going to be all in the same path. We're going to be taking and we're going to be going to the grocery store that is the free grocery store. We're going to go to the barber who's the free barber. We're going to go to the doctor who's the free barber, or the free doctor. And not only free as in money, I meant free as in, who they are, right? So those things are going to happen, and we're going to keep our money in those systems and in those groups. And the people that are inside Renegade Nation, if you're supporting those and we're supporting, we're going to not only survive during this thing, we're going to thrive. And as we thrive, more people are going to want what we have. They're going to come over. We have every business you could possibly imagine that we have in the United States is part of this 100 million people. We have trillions of dollars in this group, trillions. Anything that's not here today that they take away from us, we're going to build. I was doing a talk down in the Bay Area the other day, and this guy in Berkeley, he's got rentals, and he asked me if he could be a PMA and if it would work for his rental. And I said, absolutely yes, and we could structure it for that. And he goes, well, my friend in Berkeley, he didn't do what the city told him to do. They told him they wanted him to do something, and he said no, he wasn't going to do it. So they shut off his garbage service. It's like, well, that's what they do. And then I looked at the crowd, and I go, anybody want to start a garbage company in Berkeley? Right? And that's what we got to do. We don't need them. When they take something away, we build it up better than they had it before, and we offer it in a different way. So we can do everything that they've done, complete 100% support. What's that?
We started talking about that when we first communicated around hemp. Because I know you were really involved with, kind of growing and getting involved in that side of it, and obviously what we're doing with hemp for building and training.
New industry.
Yeah,
it's a brand new industry.
Yeah, exactly. And what I'm seeing with the way we're having to get hemp is, I can't go to Home Depot or to one of these box stores to get hemp. So we're connecting with the farmers.
Yeah.
We're seeing how this is creating a new logistics system, which is based around these decentralized agricultural areas.
Oh, you bet. Yep.
And I know you're kind of starting to get involved, like in the logistics side. Can you talk a little bit more, like how you see that going? Because we can create these different businesses, but how do we sidestep and connect them outside of this, the regular logistics system?
Oh, you bet. Yeah. So that was I think that's the solution of the Renegade Nation, because it's going to show every single business in the country that wants to be a part of this new nation, this new community, this new tribe. And it doesn't, there's other people doing PMAs. And it's like, I want you inside the Renegade Nation. I want all of your people in there. That's what we need to do. It's not about whether I do the PMA or my team or my company. I don't care. It doesn't matter. It's not about, there's other companies, the House of Markets, amazing structure, amazing people. And they're going to be part of our Renegade Nation. And I'm going to be a part of his piece, right? The House of Markets. So it doesn't matter where you're at. Our whole goal is where we're going today. And we're going together as one group of 100+ million people together to be able to create our new piece that it's already been created for us. They forced us into it. They did this. Now we're here. My wife, Vanessa, she always goes back to saying, and she's on this hard all the time. It has been for a long time. If everybody just stood up and said no to the mask right away, our country wouldn't be in this right now. And if our country's not in this, the world watches what we do, and the world may not be in this right now. So we chose to, as a nation, to just roll over and accept that for the most part. And now today, we fast forward to where we are today, and with all the vaccination passport things coming along and all the other things that they're forcing upon us. And we're in this situation for a reason. And there's two of them. One, we didn't stand up before. And then the second reason is now we're in a place where we have this 100 million plus group of people that would have never been pushed away, and we would never have been as strong as we are today together.
Exactly. Right. Yeah. And that we're rebuilding from this place of consciousness and awareness.
Yeah.
This new earth, this new model that we're all wanting. So I love that we actually have the opportunity to build it in the way that we want with the consciousness, because some of it has been, where we've come to has been from an unconscious state. I mean, even when River talks about the building,
so much.
We've done, you put houses together without thinking how toxic they were or whatever. And now we can look at the solutions. We'll rebuild the economy. Do you see us rebuilding our whole money system too, Mike? Obviously we'll have our own economy, but what's your view of how that economics will play out?
You bet. So there's a few things, and I love it when people ask that, because it's so exciting. Because the day after the first time I had somebody ask me that, a man named Jeffrey Weirnick called me. I don't know if you know who he is or not, but he's one of the partners with Dan Bongino in AlignPay. And AlignPay is going to be here to help us, and we're going to be here to help them. And they're going to grow with us, and they're going to be a piece of the Renegade Nation, and we're going to be a piece of AlignPay. And then a few days after that, I'm talking about it, and somebody goes, "Hey, there's a bank in Oklahoma that is a free bank. They're not part of the federal government." And so we have those popping up. In this little bank in Oklahoma, it's called a Regent Bank, and we're going to have other places just like that. We have Bitcoin, which is a phenomenal piece for us to be able to use as a currency, because it's the hardest currency we have, right? Our fiat system of money is garbage, and the more the country gets in debt, they just keep making more money and just throwing it out like it's nothing, and they'll continue to do that until their money system crashes completely. And we're going to have these things set up inside of our part of our world now, is inside this parallel society, even though we interact with everybody all the time back and forth, and we all know where we're at, and we know where we're going to shop and where we're going to do our banking at and do our systems at, and AlignPay, and there'll be other companies that come up just like that. And I plan on calling Jeffrey probably today or tomorrow and discussing about them actually doing a bank as well, and putting a bank out there that could be in a little more, because the one in Oklahoma is only in Oklahoma, but we need a national effect of that to be able to make it correct, right? We need to have them
Exactly. Yeah.
Where they're free. They're a free bank. You can walk into it without a vaccination passport and do your business, and then you don't have to worry about the federal government coming and stealing your money.
Yeah, I mean, makes totally sense. I totally see that vision unfolding. So we'll have to get a bunch of these resources, and obviously when the website goes live, a lot of these resources are going to be out there that you're going to be sharing. So right now, I know you're doing talks. You're based in California, but you guys are moving around like us. We're hoping to align our travels. Just saying, looking to be back, because we're leaving for Hawaii tomorrow, and then we'll be going down the West Coast from Seattle to Oregon.
Well, I need a hug, guys, so you need to come by.
Yeah, well, we will be just above you, and then we're headed over to Idaho. But
right.
But I want to talk to you because we'll be back in Texas in a month, and I know that you have
so much going in Idaho right now; it's ridiculous.
Yeah, so that was where a lot of the hospitals. Is that what?
Oregon, Idaho, California are all on fire right now. I've got a network starting in Colorado that we're trying to work with and get some stuff going. I've got a huge network in Missouri and in Kansas, and we're talking about looking at some investments to go into buy a hospital that cost well over $100 million to build in 2016. Actually, it was older than that, and they got a facelift in 2016, and it's been not used very much. And we got an opportunity to buy it potentially for a lot less than it cost to build. Like a lot, more than half as much as what it costs to build.
Wow. So we need the resource director, and then we need a map. I mean, one of the things that we're mapping out, and I know we've also talked about this. So we know we need new banks. We know we need new medical, new
insurance. We need new insurance systems, right?
New insurance systems and the transportation.
I
mean, any update on what's happening with? I know we talked with Pam Popper about truck drivers who weren't wanting to get injected and how they could shift over. So if we could shift over, for example, the pilots, that's what's happening right now with the airlines and some of the people that are standing up, or the truck drivers, and then we basically start our new distribution points. I mean, that's what we're looking at to move the hemp around, obviously.
You bet. Yeah. So in that, there are ways to help the truck drivers, no problem at all. There's actually Freedom Airline that's coming out, and they already have a network in. They're basically leasing services from other charter commuters, and they're working on buying planes. I think they're going out looking for investment to buy some planes. But we need our own airline systems, right? That we don't. It has to happen. I know that Southwest came out and said they're never going to mandate vaccinations and do all that stuff. Well, you know what? Last week they said they are, and people are getting fired, and it's like they've made a big mess. And the sad thing is that these companies have not been mandated to do this. They've been squeezed by our government to do this and bribed by our government to do this. And those are the problems. Those are the things we got to get away with.
Right. Well, I am super excited. I know people are, we're waiting for this conversation, and we're just so delighted to be partnering up with you in whatever way we can support. Obviously, we're here to do that. And again, if anybody's just tuning in, renegadenation.org will be live in 2 weeks. That's going to be the resource directory for all PMA businesses. If you haven't gotten your own PMA.
Well, even businesses that aren't too, right? Any business at all, just as long as you're not requiring vaccination passports.
Right.
Yes. Free businesses. I love the way that you're labeling it, the free businesses that are out there. So And looking forward to having you on Eric's show so we can expand this. I think once it goes live, we'll get you scheduled on there and set a date for us to converge in the physical form so that we can have
awesome.
that event. But thanks everyone for tuning in. This is the Regeneration series with Imani and River. Anything you want to say before we?
I just want to say, we're talking about this 100 million people in the US that are not going along with this and are standing up. That for every one person that's got the strength to stand up, it counters 100 people that don't have any strength.
Yeah.
So the power of 100 million people is way more than it seems in the game that we're in now. And I feel like it seems like the odds are against us in some ways, but actually the odds are in our favor completely, because when there's consciousness in what we're doing, it transforms what we're doing. Yep. When people are in fear, there's a powerlessness in that. So, thanks for what you're doing, Mike, and really looking forward to how we can support you and bring what we're doing into alignment with what you're doing, so we can be even more.
Oh, absolutely! You guys are a big piece of what we're doing here, bud. It's people just like you that are our backbone, right? That's 100%.
Yay!
Awesome. Thanks everyone for tuning in. This is live. Some of you are asking on the only places that we can are Haven Earth PMA on YouTube, and then for those of you that are on our mailing list, you'll be getting a link to this, and that is at havenearth.biz. So if you want to get on our mailing list and stay tuned. Oh, Mike, you know what we started this week? On weekly, every Friday, we're doing these community and hemp conversations.
Oh,
and
nice.
We have our fundraiser that we're doing, our PMA membership, and I'll put the link in for that. We've been putting that out there, so that's the way that we're doing it for people to support the work that we're doing. But we started a weekly conversation so people can it's really to have a live interaction. And so if people want to become an official PMA, become a member of Haven Earth, you want to explain it while I'm typing?
I mean, the construction industry is like all these other industries. It needs to transform. Mm-hmm. It needs to change, because we're living in unhealthy environments, and we're, utilizing systems that are destroying the planet, are not regenerative. And hemp offers a great opportunity, but the issue is that we just don't have the education around it right now. So we're building a course which will be online and hands-on, and definitely see how that can tie into the directory, Mike, because there's a lot of opportunities and work for people who
we need to build the workforce.
Yeah, people who are ready to be part of this revolution in building and in healthcare. It's people need the training and understand and what they need.
Oh, absolutely. You bet.
With abundance in it.
Yeah, so we're having this conversation, and it's just a resource for everyone that's making actually the physical shift to building out these new communities, and with the emphasis on hemp. So I put that link in there for everyone. Yeah, Mike, we have to talk to you a little bit more. We've got to get our bank account set up, but I want the new bank. I want the free bank. I want to become a member of that bank. I want to start that bank. So
yeah, that's exactly it. It needs to be, somebody's got to do it. Might as well be you, right?
Exactly. Yeah. So, now that we're official Texans, we got our license for our vehicles.
Congratulations.
I know there's people out in Austin. We've got Mickey Willis and Dell, and a lot of people here that, I'm sure somebody in Austin wants to start a free bank, or I'll help mobilize that. So I'll work on that and get back to you. All right, everyone. Thanks so much for tuning in. Thanks, Mike.
You bet.
Appreciate you.
Thanks, brother.
We appreciate you, bud. Thanks so much.
Take care.
See you guys.
Bye.
Yeah, see ya.